Well, good day to everybody there today. This is Dr. Murray from Murray Natural Integrated Health here in Hastings, Nebraska, doing a short little video on breast cancer and cancer in general as well, but still breast cancer is the main focus because this is October, it's Breast Cancer Awareness Month. So if this is being recorded and you're seeing this on another month, this is still applicable. But a really good message to send out there here today is that we should be beating cancer. Let's beat breast cancer. There is a ton of information out there showing that you and I have a significant impact, can have a significant impact on preventing cancer of all types and not just breast cancer. Let's talk a little bit about cancer and breast cancer in general, health, as well as things you can do today to get yourself healthier and prevent, yes, breast cancer and also cancer in general, but how about almost any chronic degenerative condition out there today. And I'm going to give you some research today from different organizations, premier ones that you're going to say, wow, I didn't know they said that. So let's talk a little bit about that. But breast cancer, we know that around 30% of all new cancers in women are breast cancer. And it's the most common cancer, of course, for women is breast cancer. So it affects a lot of ladies around our entire country. It's hard to go throughout the day and not know somebody who's been affected by breast cancer. So it's important. And there are multiple studies and organizations who have come out and said, yes, you can start doing something today about preventing and reducing your risk of having breast cancer tomorrow. So if you just right now, if you go to the Physicians Committee for Responsible Medicine. Now, this is a group of medical physicians, and they have come out repeatedly and stated that a large swath of breast cancers are preventable. And this is right in line with what the World Health Organization, as well as the American Cancer Society, have stated as well. So if you look at the World Health Organization, I'm just bringing up a couple studies here. They have come out and said that around 30 to 50% of cancers are preventable. Now, I want to make a point here is that if you have a screening test done for cancer, you have a screening test done, that's not actually preventing cancer. We know that, right? Screening actually is early finding it. It's finding the condition early enough so it can perhaps be treated early. It's not necessarily wrong, but that's not true prevention. We all should be taking an aggressive prevention stance with regards to cancer in particular, and breast cancer as well. So even the World Health Organization is stating right here that 30 to 50% of all cancer cases are preventable. That's not a big ultra-conservative natural health organization. If you also go look at the American Cancer Society, as well as the Breast Cancer Research Foundation. This is just from the Breast Cancer Research Foundation. They have stated here, first they're reporting on the American Cancer Society, and they note that around 30% of postmenopausal breast cancer diagnoses are linked to modifiable risk factors. There's several times here right now I'm going to be telling you this, that your genes load the gun, but the environment pulls the trigger. You can, through changing your modifiable and risk factors, you can change your disposition, change how your genes are reacting to the environment around you. And you may not be doomed because you have some type of condition that's in your family. Your genes load the gun, but your environment, what you eat, what you drink, what you take in, the environmental factors affects how your genes are manifested, how your body manifests these different conditions. So most certainly, even what the American Cancer Society is noting here, at least 30%, this American Cancer Society. However, the Breast Cancer Research Foundation, they say that anywhere from 50 to 70% of all breast cancers are prevented depending on how people change their risk factors, including behavior and lifestyle changes. And that's significant, right? That Physicians Committee for Responsible Medicine, that's a really interesting article I brought up here. Now, this is actually from Newsweek, and they're talking to a Dr. Christy Funk, and she talks about that is clearly a study that they did, that the Physicians Committee for Responsible Medicine did, showing that women, when they looked at the survey, they really didn't realize, when you say about prevention of breast cancer, that diet and lifestyle things are really part of prevention. Most of the ladies involved in this survey, when you say prevention, they were thinking, oh, that means some type of screening procedure. Again, screening procedures are not necessarily bad, but they are not actually preventing anything. That's early detection, not a bad thing necessarily. But when you want to prevent something, would you rather prevent something or would you rather treat something? Obviously, you would rather prevent that. And multiple studies, including the American Cancer Society, World Health Organization, the Physicians Committee for Responsible Medicine, multiple organizations acknowledge that cancer, and breast cancer in particular, have modifiable risk factors that you and I can control to prevent these conditions from occurring. So as she states here, it's clear that millions of women have yet to hear the life-saving message. This is according to the Physicians Committee for Responsible Medicine. Life-saving message that what we eat and drink strongly influence their chances of developing breast cancer. She goes on to state here that, where's that here? Okay, science, this is according to Dr. Funk, I believe is her last name there. Science shows clearly that 50% of the cases are preventable through diet and lifestyle, at least in theory. And in my opinion, this is according to the doc here, 80 to 90% of these cases could be avoided. Now, if you go also and you look at multiple other organizations talking about cancer in particular, you go to the CDC, they will state that around 80% of lung cancers are preventable. They also state here in the American Cancer Society, go ahead and look up on their website there, they'll mention anywhere, like I said, from 30 up to 50% of cancers are directly related to modifiable risk factors like diet, obesity, smoking, exercise. Another one here. Oh, this is a really good one. This is a good one here. So this is according to, where do I have my reference here? This is according to the American Cancer Society. If you go look on, there it is. Okay. So 5 to 10% of all cancers can be attributed to genetic defects, whereas around 90-95 had their roots in environment and lifestyle. So again, your genes load the gun, but your environment pulls the trigger. What we're consuming, what we're taking in has a significant impact on it. It used to be in the past that as a provider, you should not say things about cancer, about treating cancer, or about anything about cancer, especially from like saying, oh, you're going to be able to treat or prevent cancer. If you mention diet and lifestyle, used to be the standard. Now you have big major organizations such as the Physicians Committee for Responsible Medicine coming out saying doing these 4 things will significantly reduce the possibility of you having cancer, breast cancer in particular. There's 4 things: are exercise, eating more vegetables, reducing alcohol consumption, and maintaining a healthy weight. Those 4 things. Huge rocket science here, right? Those 4 things. There's enough research to indicate that doing those 4 things, exercising on a regular basis, which helps to maintain proper estrogen and testosterone kind of relationship in the body, also helps decrease blood sugar in the body, also helps to mobilize toxic waste and stuff in the body. It helps all kinds of things. It stimulates your immune system. Exercise. Doing that 30 to 40 minutes on most days of the week, good thing to do. Eating more vegetables, all the phytonutrients, all the good things that are in vegetables. If you're just eating a bunch of breads and pastas and meats all the time, if you're not getting in vegetables on a regular basis, you are missing the boat, because that's important. Alcohol, we know that alcohol is a toxin. Nobody is deficient in alcohol. And so we know that's toxic for the body, for your liver, for your brain, for your breast, and for your bones, all over your body. Alcohol is bad for men and women, and there's nothing of any nutritional value about it. And so that also increases your risk of cancer and breast cancer. And then also weight, maintaining a healthy weight. Excess of weight or adipose tissue, that also affects estrogen levels. Important thing to kind of keep some of those things down as well. All 4 of those things. There's enough information coming out there. It's important to look at that. And you say, well, okay, it's kind of like the apple day keeps the doctor away kind of thing. Is that really that big of a deal? This is the deal, is that it is a big deal. Around 75% of all the chronic and degenerative conditions that are out there, whether you're talking about diabetes or stroke or cardiovascular disease or cancer, around 75% of those are affected by what you and I take in, we eat, we drink, we smoke, or whatever. Why? Because your genes load the gun and the environment pulls the trigger. What you take into your body is going to affect how your genes manifest and work, and it's going to affect whether you die early or have complications from diabetes, stroke, cardiovascular disease, cancer, any of those things. So it's important for us to keep that in mind, that you are what you eat. That's truly the case. Now, there's lots of things you can do to objectively look at and observe what's going on inside the body. We do a lot of nutritional testing. We do IV related therapies because some people are low in B12 and they've got problems with inflammatory conditions going on in their body. It's a good thing to either evaluate and see where those true problems are. If you're vitamin D deficient, you need vitamin D. You're not going to be able to drink water and get vitamin D from it, right? So some people need nutrient support. And when we're doing that functional medicine approach and we're actually looking at where those deficiencies are, you'd like to give your body what it needs and take away what it doesn't need. Some people have a problem. I said maintaining proper weight. Well, what if you have a thyroid problem? Yeah, that's important to make sure it's evaluated. And that's why we do the testing. Not to test is to guess, to test is to know. We are doing some really fantastic new testing out there, such as liquid biopsy testing or circulating tumor cell testing. Now that testing is super cool because it's a liquid biopsy, and it's not a replacement for an actual physical biopsy, but it is really great information because it gives you an idea of what's going on inside the body, but also whether those tumor cells that are there, how are they genetically expressing? So for instance, if you have a tumor cell that actually is expressing more so when your insulin is high or glucose is high, you can measure the genetics of that cell. And so it gives you a good idea of whether or not you really need to cut back on your glucose and sugar levels. Also, some people, are taking B12 and folic acid. Have you ever heard this before, that you shouldn't be taking B12 and folic acid for cancer? And that's why, the reason why for that is because some people, their genetics, the way their cells are manifesting, they are actually growing and proliferating with B12 and folic acid and different nutrients. You can test the genetics of that with a liquid biopsy, which it gives great detail. You can also look at chemosensitivity through that liquid biopsy. And the chemosensitivity can look at, see if, okay, does this cancer cell not like vitamin C? Is that helping to create apoptosis or killing of that? Or how about with regards to different herbs? Certain herbs might reveal that when you expose that particular tumor cell to quercetin or maybe oregano or something like that, that it doesn't like it. So that gives some really good data as to how to support these people along the way who have different cancers to down-regulate some of the expression of those genes and support them, those that have chronic degenerative conditions, including cancer through life there. So it's a great test that we do there, and it's not being offered anywhere else in this area. Also, when you look at thermography, we do thermal imaging here. And I'm not against somebody necessarily having a mammogram, not necessarily a bad thing to have done. If you have a lump or a bump or a mass, it needs to be evaluated thoroughly. But some people, of course, they don't have those issues going on, and they may be young, they have concerns. Well, thermal imaging is an adjunctive test, and so is the liquid biopsy test, is an adjunctive test to other testing. And this adjunctive test, thermography, looks at the health status of the tissue. If you have any lump or bump growing within your body, you're going to grow blood vessels to that area, whether it's a benign bump or a malignant bump. And so you growing those blood vessels, that area is called angiogenesis. And so a thermal imaging, breast thermal imaging, gives a good data as to what kind of circulation issues are going on there, and is that perhaps abnormal compared right versus left, looking at symmetry. Again, it's an adjunctive test, and it just gives more clarity and data, so you can give people the right information so they can have a good whole health plan moving forward. Lots of other things that we also offer in the office here. Of course, we look at hormone therapy. Some people should not be doing hormone therapy. Of course, during that liquid biopsy test, you can see whether that particular tumor perhaps has a predisposition towards proliferating and growing depending on what kind of hormone might be given to it. So you can see that on a gene test like that. So, but some people they need nutrient support. They need antioxidant support. They need a variety of different, maybe detoxification support, looking at their heavy metals, looking at their toxic exposures. You'd like to give the body what it needs and take away what it doesn't need, because the body then can heal, repair, and self-regulate as it's designed. What are your deficiencies? Where are your weaknesses? If you're not testing, you're guessing, because not to test is to guess, but to test is to know. And that's what we're all about here at Murray Natural Integrated Health. So give our office a call at 402-463-4257. And also do those 4 things, right? Exercise, eat more your veggies, fruits and vegetables, those things. Also, decrease or eliminate your alcohol consumption and maintain a healthy weight. And let us know if we can help you out with any of that, because we are here and ready to aggressively prevent any of the conditions I just talked about here today. So Murray Natural Integrated Health, setting the standard in natural health care. Have a blessed rest of your day.